As the year 2010 drew to a close, a group of University of Missouri students set off to begin the new year in a land unknown to them. Our destination was Cape Coast, Ghana, Africa. Our mission was to educate and provide services in public health for the citizens of this community. This particular study abroad group was paired with the Pro World organization, in which the students were organized as volunteers with partnering non-governmental organizations, or NGOs. These groups were designed to educate and provide services dealing with the issues of public health for the Ghanaian people. These groups dealt with issues from sanitation to HIV and AIDS. The particular group preparing this picture documentary were part of the NGO Needed Life Foundation. Its main task was an education and testing of pregnant mothers with HIV and AIDS. As well as our work with Needed Life, we were also charged with the task of creating a windshield survey. This task was assigned to create a chance to report on many issues of life regarding public health in the areas of Cape Coast and Elmina. Our survey focuses on the area near the clinic in which Needed Life was located. Our program, Needed Life, was based in Elmina, a small town a short drive west of Cape Coast. Needed Life was directed by the wonderful Fatih Kahinde, as well as with the help of our brothers Victory Kellis and Anthony Sampson. Our work with Fatih was centered in the Ghana Health Services Clinic. The foundation was awarded a room in the Women's Health Wing to see patients. Overall, the entire clinic itself sees about 200 to 300 patients a day, even more so taking account of the attached maternity ward. There are only 3 doctors in the clinic. Patients wait in line outside the doctor's office. When one patient leaves, the next one simply enters. The doctor does not move or leave the room at all. No appointments are made. Unlike healthcare facilities in the U.S., patient confidentiality in these clinics are much more lax. It is even the responsibility of the patients to keep their own medical records. The healthcare provider writes down important medical information in a school notebook and gives the record back once the meeting has concluded. Within Needed Life Foundation, approximately 70 pregnant women are tested for HIV each day. In 2010, Needed Life tested 975 patients. That's 975 Ghanaian women who could be assured of their HIV status. Due to the high cost of medical supplies, items such as gloves were used sparingly. In the U.S., it is required that personal protective equipment be discarded between each patient contact. Here, unless gloves were visibly soiled, it was not urgent to discard these pair of gloves. Problems with this type of practice could be infections and/or cross-contamination. As well, a cardboard container for the lancets used in the testing is the choice receptacle. This could lead to accidental needle sticks, which are protected against in the U.S. by hard plastic sharps containers. Other human services are also available in the Elmina area. However, unlike the U.S., these services are scarce and highly inaccessible to many. Ambulances and fire engines were present, yet very rarely used. Even if these services were used, transportation issues to be discussed shortly, along with outdated supplies and equipment, would render these vehicles ineffective. Other services such as pharmacies and social services, mainly composed of non-profit organizations, were available in Elmina. Like the health services, these places could be found in higher populated areas of community centers. However, access was not available to all. In the U.S., we are familiar with senior centers and child care facilities. Other than schools, no such services similar to those in America, such as Boys and Girls Club or Head Start, were present in the area in which we investigated. A service that was of great value in Ghana was the radio. Upon interviews of individuals with increased knowledge for specific items such as public health issues, it was often asked where one was exposed to this education. It was highly likely radio was the primary source. The radio is a major source of entertainment and news. The radio is also one of the biggest sources of public health education. Ghanaians listen to the radio in several settings, as they work, shop, and even on their various daily commutes. The radio projects information through campaigns such as AIDS is Real, which educates the general public about the danger of AIDS, how AIDS is spread, and dispels common myths associated with HIV and AIDS. Replacing myths with real facts have heightened the understanding for practicing sexual health. 84.2% of women and 92.2% of men in the central region of Ghana believe that using condoms can prevent HIV. 70.7% of women and 92.1% of men in the central region of Ghana know a source for condoms. However, only 0.8% of married women cite using a male condom as a source of contraception. 77.1% of married women do not use any form of contraception whatsoever. Much of this can be attributed to economics as well as access. For most, the means to travel to a source for condoms is difficult to come by. HIV and AIDS continues to be a large problem in this region. However, a promising rise in sexual health education is continually seen. Both inside our work in a clinical setting at Ghana Health Services of Elmina or walking amongst the residential areas in our community outreach programs, AIDS was a main focal point in our outreach. Education of facts surrounding HIV and AIDS has been paramount in slowing the transmission of this virus. Even if one were able to travel to these sources, the price for condoms is highly expensive for Ghanaians. Outside of the walls of Needed Life Foundation, a greater insight to public health concerns of Elmina residents was revealed by Journeys Through Dusty Roads. Our community outreach was led by our great friends Victory and Samson. The intentions of this program was to provide education to various health topics such as sexual education, tuberculosis, and malaria, among others. With our door-to-door visits, we were able to provide information through several pamphlets which were donated, as well as condoms to sexually active individuals. Welcome to Inspect Their Domiciles. Our neighborhood visits opened a window into contributing factors regarding the health of Ghanaians in Elmina. Upon initial inspection of our surroundings, we found that nearly all roads throughout the residential areas were beaten dirt paths. Both women and men are seen walking about while children are playing freely in the areas within residential compounds. A great amount of interactions are seen within members of the communities. Most residents in these neighborhoods rely on help and trade from others nearby. Running alongside the children in the neighborhood are a collection of free-range animals. Unlike many regions in the U.S. in which farm animals are kept within fences and gates, goats and chickens are allowed to roam freely throughout the terrain of Elmina. The residents of the Cape Coast Elmina area are incredibly friendly people. Most, if not all, locals were very warm and welcoming. Children and young adults were open to having conversations with us. Their ability to speak English was fantastic. More language barriers were seen with the older populations as they primarily spoke Fanti. The neighborhoods provided evidence and confirmed the low socioeconomic status of the area. Luxuries as well as some basic necessities were absent from these places. However, the communities seemed very stable and without noticeable levels of unrest. Even with high poverty rates, homelessness seemed to be non-existent in these areas. In the most recent figures available, Missouri holds a 13.5% poverty rate, while 28.5% of Ghanaians fall below the poverty line. Issues of homelessness are multidimensional. As Western culture states, one without a home or haven is homeless. In Ghana, these standards are different. Many communities in Ghana are comprised of living structures that house large families and friends of the family. Therefore, most individuals can seek shelter in these open communities. Because the wonderful individuals surrounding the area of the clinic were so warm and inviting, we were able to enter many households to discuss the areas of public health concerns with them, while educating and sharing information to further their understanding in these issues. Housing was comprised of very simple structures. The building materials used for these homes were of the most basic kind. Most seemed to be comprised of stone made from surrounding clay mixed with cement or other materials that made sturdy walls and could be obtained locally. The roofs were a covering of thatching or simple metals to keep out most, but inevitably not all outside elements. These homes were often scattered sporadically within the communities, or arranged in a compound in which several huts or homes shared a common outside area enveloped in a fence or other barrier. This is much different to how homes are generally lined up along one another facing roadways to subdivisions in Missouri. Upon further assessments of homes in Elmina, we noticed rare usage of mosquito nets. Although not absent, there certainly was not enough to cover all household individuals while sleeping. With the high prevalence of malaria in this region of Africa, it appears that more mosquito nets are needed to fulfill the requirement. Another major concern with housing was the lack of ventilation due to few windows. This poses a problem in an area that suffers with infections of tuberculosis. In 2010, Missouri had 107 cases of tuberculosis, not including latent TB. This is approximately 2 in 100,000 Missouri residents. Ghana and its communities have an infection rate of nearly 203 in 100,000 individuals. This problem is compounded if we look at TB being an opportunistic infection that can affect HIV and AIDS sufferers. Homes in Elmina, as previously mentioned, are collections of family and friends. Unlike homes in Missouri, no lawns were present as most grasses are wild and they do not procure yards full of domestic grasses. To most of the students, these homes look tattered and in disrepair. However, missing doors and other items in need of replacement were of the norm in this area, and their presence had no evident effect of the life of the residents, as you could gauge by their overall peacefulness and smiles that were observed.